host or those for today's FB and Instagram live session. Indian origin folks living in US. If parents are visiting from India and you are looking for medical consultation, well, look no further. eGlobal Doctors has your back. In today's Facebook and Insta live session, we will be exploring and providing you more information about venous thromboembolism. I butchered the name. It's actually VTE, and we have the expert in-house who will be helping us, Dr. Katyal. Dr. Katyal is ICU critical care expert, board certified in 5 specialties: internal medicine, sleep medicine, critical care medicine, neurocritical care medicine, with over 25 years of experience. It's really nice to meet you, Dr. Katyal. Thank you for sparing time. How are you doing this evening?
I'm doing good. Thanks for having me back.
It's always wonderful to have an expert like you, Dr. Katyal. Pleasure is all ours. So what do you say? Shall we dive in today's topic?
Sure.
So I know that I butchered the name. I don't want to say the name, but I'm going to ask a question and then you can actually expand it for our listeners and our viewers. So what is VTE?
So VTE stands for venous thromboembolism. And what it signifies is clot in the venous system. For the most part, we are talking about clots in the legs called DVT, that is deep venous thrombosis, and then clots in the lungs, that's called pulmonary embolism. So these two would be the majority of VTE, but also I would point out is you can have clots in the upper extremities too, and also clots in the veins that, are in the brain, or veins that are in your abdomen. So any clot in any venous system would be VTE, but for the most part, when we use the term VTE, it signifies in general clots in the legs or clots in the lungs.
Okay, so anytime we see blood clots in vein, that's what VT is.
Exactly.
Okay. Perfect. Thank you for boiling it down, and thank you for pronouncing it correctly. So what are the symptoms of VTE?
So again, as I said, that VTE involves mainly the lower extremities and the lungs. So if you have, swelling in the legs, pain in the legs, that could be a symptom of a clot in the legs. As far as the lungs are concerned, you can present with, shortness of breath or chest pain. So you always need to think about that. So if, again, as I said, if on a rare instance, you can have clot in the veins that drain the brain, you can have headache or seizure. Similarly, in the upper extremities, you can have swelling or pain, and that could be a sign of venous thromboembolism.
So you touched upon the word swelling. So if for the swelling, if it's one of the symptoms, does it mean a swelling comes and goes, or the swelling just stays there?
No, the swelling will stay there. It will not come and go because it's the blood that is being drained, whether it is upper extremities, lower extremities. Then, if that's the cause of the swelling, till it is addressed, the swelling will persist, but it will not come and go.
Okay. So no appearances, cameo appearances, it was just going to be there.
Exactly.
Okay. So what are some causes of VTE?
So when we say VTE, it is a very complex diagnosis, but for the layperson, what I would put it is that you have to look at two different things, whether the clot is provoked or it is unprovoked. And provoked means there is a reason for the clot to happen. So amongst the reasons would be, immobility. If you're not mobile, this happens, after you have a hip fracture or say a knee fracture, or you're admitted to the hospital where you're lying in bed. Sometimes it happens because, you're on certain medications. In females, oral contraceptives, that's a risk factor for VTE. Then you have other risk factors like, diabetes. Then you have heart failure, lung problems like COPD, liver failure, all those things, obesity, sleep apnea, all those are risk factors for VTE. In general, as you age, beyond age 50, that becomes a risk factor for VTE. So if there's a proximate cause for it, we say it is provoked. And if it happens without a cause, that you were doing fine, and then we diagnose you with it, and there is no risk factors, then we say it is unprovoked.
Wonderful, because I was going to ask then what is unprovoked. So that's uh, thank you for letting us know. So hopefully people who are listening, if you are concerned, you know what's a provoked and what's an unprovoked VTE. So blood clots. What are some first signs that someone might have some kind of blood clots in them?
Again, as I said, if it is in the extremities, then you may have swelling. As I mentioned, that if it is in the lungs, then you may have shortness of breath. You may have chest pain. Sometimes, because the blood clots cause so much of burden on the right side of the heart, you may have what we call as a fainting spell, a syncope, that you passed out at home. And the reason for that was the pressure on the right side of the heart was so high that there wasn't enough blood circulating to the brain, which caused you to collapse. So those would be some of the symptoms and signs. But as one sees a patient, if you have a suspicion, obviously there's a history, there's an exam, and then we do a blood work. And there's something that people may have heard, something called D-dimer. That's a blood test that we check. And if it is based on your probability, there are certain scores like, Wells score, Geneva score that we put into the algorithm. And if we suspect that someone has a PE, then we do a blood test based on a pre-test probability. What do we think? Is this a low risk, intermediate risk, or high risk? If we think this is high risk, then we straight away go to the diagnostic test. But if it is low or intermediate risk, we may rely on this simple blood test called D-dimer. And if it is negative, it pretty much excludes that you don't have a blood clot. But if it is positive, then it does not mean you have a clot, because there are other conditions that can cause a positive D-dimer. So it has a very strong negative predictive value. But if your suspicion for a blood clot is high, you straight away go to the diagnostic test. In between, you'll have X-ray findings. You'll have the oxygen level that is low if you have a blood clot in the lungs. You have certain EKG findings. Then the gold standard is what we call as a CT angiogram. That's a CAT scan of the basically lungs with a dye that is injected, which looks at the blood vessels supplying the lungs. And if there's a clot, it is picked up on that. So that's how you make the diagnosis. And sometimes, if you're not able to use the contrast because you have kidney failure or something else, which would be prohibitive, we can do another test called a VQ scan. It's a nuclear medicine test, which is not as reliable as a CTA, but the gold standard would be the CTA to make the diagnosis.
Wonderful. So thank you so much for highlighting those. So it's actually really, it makes me very happy that you guys are there and doing what you have to do. So make sure that we are safe. And if something needs to be happened, then, we work on it. I've always heard that exercise, eat proper food, exercise, sleep on time. So can exercise help in blood clots?
So when someone develops a leg clot or a clot in the lungs, as I mentioned, immobility is one of the risk factors. But once the clot develops, then you have to use blood thinners. And I would point out that these blood thinners do not do anything to the existing clot. Your body's own inherent system will help dissolve the clot over time. But using blood thinners prevents new clots from forming. So lack of mobility or lack of exercise is definitely a risk factor. But if a clot is already formed, yes, then we do suggest that you should, exercise and walk, because there are complications that go with VTE.
Okay, thank you so much. So please don't stop exercising. Exercising is very important. So is VTE a stroke, or can a stroke be caused because of VTE?
So VTE is, as I mentioned, a problem in the venous system. And for all practical purposes, your lower extremity and your lungs. As I mentioned, it could be in the upper extremity. It is not as common. I mentioned in the abdomen, certain veins are there, like the splenic vein, superior mesenteric vein, or portal vein. They can develop a clot. Or as I mentioned, a clot in the brain, the veins that drain blood from the brain, those can develop clots. So when we say VTE, it's a problem in the veins. When we say stroke, it's an arterial problem. It's not a venous problem. When we say stroke, it's a problem in the artery. So can VTE cause a stroke? It certainly can, but it's one of the very rare causes. And how can that happen? You have a blood clot in the legs. It goes up into the lungs through the heart. And if you have a communication between the right and left side of the heart, which is called a PFO, then that clot can go to the left side of the heart, and from that left side of the heart, go to the aorta into the brain. We call this as paradoxical embolism. So that's the only situation where a VTE can cause a stroke, because a clot originated in the veins, but ended up in the arteries because there was a communication between the right and left side of the heart.
That's very complex, but the simple answer is yes, it could be one of the causes for the stroke.
But very rare cause. So if you look
Very
at the
rare.
causes of stroke, there are so many other causes, like, someone has uncontrolled hypertension, irregular heartbeat, you have your left heart that does not have a good ejection fraction, which can lead to clots we call cardioembolic, that, there's a clot that forms in the heart or in the vasculature. From there, it goes up into the brain. So that's the most common cause. But if you don't come up with the cause, and then you have a history, then you do pursue this paradoxical embolism in your differential diagnosis.
Okay, wonderful. Thank you for boiling it down. So I just want to let our listeners and viewers know we are live on both Facebook and Instagram. So hop on your favorite social media, where we bring you interesting topics every week. And if you are joining us right now, we are in conversation with Dr. Katyal about VTE. So who is at high risk, doctor, for VTE?
Again, as I said, the risk factors I mentioned, alluded to earlier, and that, once you age, if you are diabetic, if you are immobile, traveling 4 to 6 hours by car, by air, that's a risk factor. So we've had huge, personalities like former Vice President of United States, Dan Quayle, in his 40s, developed a blood clot just because he was traveling long distance transatlantic on a trip, and he developed a clot. There were no other risk factors. So those are some of the things. But when you see blood clots in people who are very young, below age 50, that means there is more to it. It's not the age. Again, as I said, above 50, you develop blood clots. Then you start thinking of, is there a family history? Did you inherit it? So if you're suspicious of that, and if you develop blood clots in rare areas, like in the splanchnic circulation, that means in the mesenteric vein or in the veins draining the brain, then we do a workup for thrombophilia. And by that, I mean there are certain inherited disorders like, protein C, protein S, antithrombin 3, prothrombin gene mutation, factor 5 Leiden. These are inherited risk factors. And then there is something called acquired risk factor, which is called antiphospholipid antibody syndrome, which can cause both arterial clot as well as venous clot. So depending upon the scenario, we can do the workup. But as I pointed out early on, the most important differentiating feature is the VTE provoked or it is not provoked? Because if it is provoked, the treatment is you use blood thinners for 3 months and you can stop. If it is unprovoked, then means that you don't have a risk factor, but you developed a clot, then you should consider indefinite anticoagulation. And I said should, because each person is different. So when you are on a blood thinner, it's a risky proposition. You can bleed. If you fall, you can bleed in the head. So you have to look at the, risk factors and then see what are the advantages, disadvantages of continuing a blood thinner based on the risk of bleeding and based on the risk of clot forming, and then decide on an individual basis. So if I were to point one major factor in VTE, the most important thing is it provoked or is it unprovoked?
Understood. So you touched upon that prolonged travel, whether it's by car or whether it's by plane. So is it because the movement was restricted and we were like sitting? That's why?
So when we talk about VTE, there is a term called Vercoe's triad. That means you need to have 3 things to develop blood clot. One is stasis. That means blood is not flowing. That is where you're sitting. whether it's in car, whether it is in the train, whether it is by ship or by air. So if you're sitting, immobility, that's a risk factor. Second is whenever you have any injury to the vessel, that has to be there. So people who have trauma, etc., they are at high risk. And third is you should have a propensity for your blood to clot. So if you have all those three factors, that's what leads to blood clot. So when you're traveling 4 to 6 hours and beyond, then that becomes a risk factor. And if you're obviously traveling and sitting in one place, and that's why we see even if you're traveling by air, obviously you are very much limited, but periodically you should get up and walk as much when you're traveling long distance.
So a follow-up question to what you just explained. We all have been working from home, or flexible or hybrid. So we are confined in our chairs. Does that also a risk factor?
Definitely, if you're immobile for long periods of time, that does become a risk factor. So that is why keeping yourself up and walking is always a good thing. And that's what we also saw with recent COVID-19. If you were at home, one of the things we told everyone was, keep looking at your oxygen saturation, but also keep moving around, because it's debatable whether COVID-19 increased the risk for blood clots or not. That's still, the jury is not out. But certainly we saw a fair amount of patients with COVID-19 who developed blood clots.
So it's really important, whoever is listening to us, stand up and move. If the environment is safe to be moving around, but please don't be in a prolonged stagnant position where we are not moving. That's actually good to know. I did not know. So because I don't travel that much, but I do sit in a chair for long hours. So I know what I have to do and take periodic breaks. So let me quickly check. I don't see anything in our chat. So before I move on to my next question, Doctor, I'm going to quickly talk about diet consultation that eGlobal Doctors is providing. So eGlobal Doctors have actually started new diet consultation, nutritional coaching to reverse chronic diseases. Get started with 2 free diet consultation. Yes, you heard it right. 2 free diet consultation. They have multilingual nutritional coaches, diabetes remission, detox program, weight loss, gut health, child nutrition are few to be named among other several diet programs. The programs are 3 weeks or 3 months, depending on your need. How does this program work? eGlobal Doctors, they will help you understand the root cause of the problem, will take in-depth case study, help you understand what is mindful eating. The recommendations are based on their individual taste and preferences. Healthy habit formation until you reach your specific goal, will hold your hands from the beginning till end to achieve optimal health. And their approach is totally scientific along with some holistic transformation tool. If you're still thinking, you can schedule a free consultation with their top-class nutritional coaches. Visit or register today at eglobaldoctors.com and book your appointment to get a proper nutrition coaching. So let's go back to our questions. So what is the difference? You actually mentioned a term PE, I believe. So I want to ask you, what is the difference between VTE and PE?
So again, as I said, PE is part of VTE. So VTE is the big term that stands for blood clot anywhere. And PE is pulmonary embolism, that is the blood clot in the lungs. But the majority of the clots that come to the lungs come from the lower limb. So you develop a clot in the lower extremity, and from there it goes up into the veins, from the inferior vena cava to the right side of the heart into the lungs. So PE will be a subgroup of VTE.
Okay, so VTE is like the parent and the child, the tree, if you say, so the PE lives under VTE. Okay, perfect. That is another good information that you shared with us. So then what are some long-term complications? You talked about blood thinners. We do it for 3 months, but I want to know if somebody has clots. What are some long-term complications of VTE?
That's a very good question, because we always think about the immediate problem. But if you have like a clot in the legs, we describe what is called as post-thrombotic syndrome. That means you can develop such significant leg swelling. It can be painful. And that's why we say once you develop like a clot in the legs and you're put on blood thinners, you should ambulate, you should walk. And then we ask that you use something called compression stockings so that, the blood does not stay stagnant. Similarly, if you develop a clot in the lungs, once the acute phase is over, the most dreaded complication is, in medical term, we call it as CTEPH. That stands for chronic thromboembolic pulmonary hypertension. That means the pressure on the right side of the heart is elevated because of these clots that still reside in your lungs, in a distal, like in the periphery of the lungs. And in addition to that, people who develop PE then complain down the line of anxiety, something like a PTSD phenomena. They complain of shortness of breath, inability to walk, depression. You have right ventricular dysfunction. There are so many things that can happen downstream as a result of the pulmonary embolism.
Thank you for that. So hopefully people who are listening to us or will listen to this recording will actually gain a lot of information. So I do see a question that came to us on one of our live platforms. And the question is, what organs are affected by VTE?
So again, as I said, most of the organs, wherever you have veins, so lower limb, upper limb, your belly, where you have the veins that drain the blood from your gut, your lungs, and again, as I said, in the brain, you have veins draining blood from the brain. And more importantly, people may have heard the term clot in transit. That means the clot that is there in the legs is moving towards the lungs, but is in the right side of your heart. So you can sometimes, because of the ultrasound we do on these people, we see this mobile clot on the right side, which is a very big problem, because clot in transit in 24 hours, if not addressed, it has a 46% mortality. And just to put things in perspective, the pulmonary embolism itself, the 90-day mortality is 20%. So it is not something to take it, lightly. And if you look at the whole picture, cardiovascular mortality worldwide, the most common cause is myocardial infarction. Second cause is stroke. And third cause is pulmonary embolism, or VTE. So this is something that always stays under the radar, but you see a fair number of patients with VTE.
So please don't take it lightly. If you have any of the symptoms that doctor was describing, make sure you do consult a physician and one of the experts to make sure that this is diagnosed in a timely manner. So thank you for that. And hopefully whoever asked this question on live, you actually got the response. And if you have any follow-up question, we do take questions live while we are talking to our expert. So let's see. We talked about the symptoms, we talked about causes, we talked about long-term, complications. Now, is this something which can be prevented? So how can we prevent VTE?
So again, as I said, that once you have certain risk factors, and that's why, once you get admitted to the hospital, for example, you will realize there's a treatment dose of anticoagulation, there is a prophylactic dose. So if you are in the hospital with, heart failure, COPD, or liver problems, or anything, or you are undergoing surgery, then all these patients are put on what we call as prophylactic dose of an anticoagulation. That may be something called low molecular weight heparin, unfractionated heparin, or something called fondaparinux. So these are the medications we give for prophylaxis to prevent a clot from forming, because you are immobile, you're in the hospital, and you have other comorbid conditions. That's why to prevent blood clots after hip fracture, after knee fracture, obviously your mobility is limited. So these patients, because some of these other medicines I mentioned, they are injectables. You have medications called NOACs or DOACs. They can be taken orally, the most common being rivaroxaban and apixaban. Those are available worldwide. So whenever you have like a fracture and you know that you're going to be immobile, so for the next several weeks, the doctors will put you on a prophylactic dose of this medication to prevent blood clots from forming.
Thank you for that. So it's very important. Keep moving, unless and until doctor described that you're in a hospital bed and your mobility is restricted. Otherwise, keep moving. I don't see any more questions on the chat. I'll keep an eye on that. So I'm going to quickly talk about the diet consultation that eGlobal doctors have started, nutritional coaching to reverse chronic diseases. You will get first two free diet consultation. They have multilingual nutrition coaches, so language is not a problem. Diabetes remission, detox program, weight loss, gut health, child nutrition are few to be named. If you want to know more, please hop on to eglobaldoctors.com. So quickly checking the chat. Okay, I do see one question, doctor. So another question that we got is, what is the early sign or symptoms of VTE?
So, I'll be very frank, like on the legs, I mentioned you may have swelling. A lot of times when people have, catheters called PICC lines, those are intravenous catheters that are put in the upper extremity for, long-term antibiotics, for other reasons, then you can see swelling. But a lot of times, you don't even suspect. Someone comes in with shortness of breath, that's so non-specific. And we each time say, oh, that's nothing. You just had some allergies, you had an asthma and stuff. So sometimes it's just, you don't know. And when you do the imaging, you find it. So the symptoms, like for a PE, again, as I mentioned, could be just shortness of breath. It could be chest pain. It could be you had a passing out spell. Sometimes you can cough up blood. And if you get an X-ray, sometimes you may see a totally clear X-ray, but your oxygen levels are not high. And that again suggests that there is a blood clot, and which is creating what we call in medical terms a dead space. There is no oxygen CO2 exchange occurring because there is no blood flow to that part of the lung. So those are some of the things that you have to have a high index of suspicion. And again, as I said, the symptoms, the signs, the blood test, the pre-test probability by looking at the Wells score, Geneva score, looking at the EKG, X-ray, and then leading to a CTA leads to the diagnosis. But you have to have a high index of suspicion in these cases. So you test the probability, and they say that you can put these symptoms in all these algorithms, but a smart doctor can look at a patient and say, your X-ray is clear, you are short of breath, your oxygen level is low, I think you have a blood clot in the lungs. That is as good as any of the scores, as I mentioned. So the clinical suspicion has to be there.
And that's why you are a subject matter expert, Dr. Katyal. We don't trust our machines. We do trust them. They're very important. But, of course, an expert opinion like you goes a long way. So hopefully whoever asked this question, you got the answer. I have another question from live, and that question is, what can be used to prevent blood cell while on long distance travel?
So the guidelines don't recommend that, so again, it boils down to the risk factors. And amongst the risk factors, I mentioned a lot of them. One other major risk factor is underlying malignancy or cancer. That puts you at a very high risk for VTE. So you, in that situation, if you are going to travel long distance, this is not a guideline that is recommended across the board, but you have risk factors like underlying cancer or any other, comorbid condition, then you could potentially take a prophylactic dose of blood thinner, balancing the risks and benefits on an individual basis. So the medicine that I mentioned, low molecular weight heparin, is once a day medication. The fondaparinux is once a day medication, but the unfractionated heparin is 3 times a day. So if you're traveling 8 hours and if you take one shot of Lovenox, which is low molecular weight heparin, which is 40 milligrams, that should cover you for 24 hours. So on a case-by-case basis, these are not the guidelines. You discuss with your doctors, these are my risk factors, these are the benefits, because when you are on a blood thinner, there's always risk of bleeding, even things like aspirin. So you weigh the risks and benefits of any intervention. And if you're at high risk, then there is no harm in taking a shot of Lovenox, which would prevent blood clots if you're traveling long distance.
Okay, so probably whoever asked is either having a long distance trip coming up or they travel a lot. So hopefully you got the answer. Consult with your doctor, and if needed, go on the medicine that doctor just described. So with that, it's a wrap, Dr. Katyal. Again, it's always a pleasure to have you. You increase our knowledge immensely. So before I let you go, any word of wisdom that you want to share with our listeners and viewers?
I will just point out a few like rare things. Sometimes you will see these clots in very young people and people who play violin. Because of, as I said, trauma that is created here to your chest, you can develop upper extremity blood clots. This is called like Paget-Schroeder syndrome. And in females in their 40s, if they develop blood clots in the left leg, then there can be an anatomical variant where your left iliac vein is being compressed by your right iliac artery. So the vein is under the artery, and because it is compressing it, it is preventing blood flow, which is then causing stasis and causing blood clot. The reason I mention this is because this is not treated with a blood thinner. This is treated with a stent. Because of the narrowing, you have to open it. So you have to have that suspicion. It has been noted in females in their 40s, if they develop recurrent or blood clot in the left leg, then you should worry about this syndrome is called May-Thurner syndrome. So there are some rarities too that you should always be on the lookout. Not everyone does not fit one box, so you have to have that clinical suspicion.
That's wonderful, and that's absolutely true. So, if you have any kind of doubt or suspicion, it's actually always good to have a second opinion. Thank you so much for that insight, Dr. Katyal. It's really wonderful to have you. And this is Kunjan signing off. Stay tuned for our more interesting topics. Stay safe. Namaskar, doctor.